Welcome to Physiology Case Scenarios, Cardiovascular Series 4. This module deals with electrocardiography. Case 1. A 65-year-old male consults his physician for the complaints of generalized body pain, weakness. There is no history of fever. Patient is a known hypertensive and diabetic. Lab finding reveal serum creatinine 4.1 milligram per deciliter, normal is 0.6 to 1.2, raised significantly. Serum potassium 6.3 raised again, 3 to 5, 3.5 to 5, normal. Fasting plasma glucose is high, 182 mg per deciliter. His ECG should most likely to show which of the following changes on account of the electrolyte abnormality. It's a long list of abnormalities. We have to pick up the right one for the electrolyte disturbance, that is hyperkalemia. Other findings do not change the ECG pattern. Serum creatinine has no direct effect on the ECG finding. Glucose again has no effect. Serum potassium, plasma potassium has direct effect on the ECG. Hyperkalemia produces classical ECG effects. Hypokalemia produces classical effects. Let us pick up the hyperkalemic effects. Prolonged QT interval is not correct. ST depression is not correct. Presence of U waves not correct. Prolonged QRS correct. 4 is correct. Peak T waves correct. 5 is correct. ST segment elevation is not correct. Inverted T waves are also not correct. Prolonged PR interval is correct. 8 correct. Flattened P waves, yes, correct. So it must be the 4, 5, 8, 9. Let us pick up these 4, 5, 8, 9 is there. Yes, first one. 5 options are there. All others are wrong combinations. 1, 2, 4, 8, 2, 3, 6, 3, 7, 9. 6 and 7, they're all wrong combinations. The correct combination is 4, 5, 8, 9. These are the classical findings in hyperkalemia. Presence of peak T waves as if they are pulled up. Prolonged QRS duration. Peak T waves appear very fast. Then you have the prolonged QRS, prolonged PR, and the flattened P waves. They're all due to problem with the excitability and the repolarization processes. 2. QRS complex of ECG is redrawn from the ECG record of taken from lead 2 from an elderly patient who was admitted with severe chest pain and profuse sweating. He was hypotensive with blood pressure recording 80/50. There was tachycardia. So it looks like the myocardial infarction. The ECG shows typical ST elevation with convexity upwards. The diagnosis must be myocardial infarction. This is a classical finding within hours of the onset of the infarction. There is a cell death due to ischemia, severe ischemia, part of the myocardium, leading to cell death is called myocardial infarction. The typical symptoms are tightness or pain in the chest with profuse sweating, may lead to hypotension or decrease in the cardiac output, cardiogenic shock when there is tachycardia. This is a typical picture occurring not immediately, few hours you see this ST elevation. Sometimes you miss the ECG changes if a person comes very early, but because of other investigation you can diagnose myocardial infarction. 3. A 40-year-old man complains of giddiness and frequent syncopal attack. He is advised artificial pacemaker implantation following investigation. His ECG tracing in one of the leads is shown below. ECG shows abnormality with no relation between P and QRS. P occur independently, regularly. QRS occurring independently of P but irregular. You can see the RR interval changing. Question: which of the following abnormalities in the above ECG is the evidence for therapeutic decision? The therapeutic decision is implantation of the pacemaker because of the irregularity in the heart attack and his symptoms. The options are widened QR complex, not very evident here. Abnormal P waves. Now P waves are normal, occurring normally but independent of the QRS. Irregular PP interval. PP interval also looks normal or regular. PP is coming very regularly. Irregular RR intervals. Yes, RR intervals are irregular. Look at this. This is large interval. This is smaller interval. 1, 2, we will label it as. This causes arrhythmias. Sometimes it is very wide and the bradycardia. The episodes of tachycardia, bradycardia may be occurring here. So there is problem with the rhythm, arrhythmias. It causes giddiness, syncope, person needs the implantation to regularize the heart rate. Artificial pacemaker. You can see the answer here. The RR interval in 1 looks like 8 big boxes, about 40 small boxes. That amounts to each big box measures 0.2 seconds because of the speed of the paper, 25 millimeter per second. So each big box is zero point 0.2. So small box is 0.04 seconds. 8 times 0.0, 1.6 second is the RR interval. That is the cardiac cycle duration. So 60 divided by 1.6 comes to 38 per minute. Heart rate is very, very low. So this is the reason for artificial pacemaker. In 2, it's almost normal. 0.8 seconds. 4 big boxes, 25 heart rate. You cannot say heart rate unless it is regular. Heart rate varies. That means the rate, cardiac rate ranges from 38 to 75 or more. So this is the abnormality. So very irregular pulse will be the finding. Case 4. A 45-year-old man has recurrent episodes of chest discomfort and pain over the medial aspect of left arm while doing certain heavy work. There is no sweating or weakness associated. Patient reports the pain is relieved by rest. ECG shows evidence of ischemia and diagnosis of angina pectoris was arrived at. He is advised sublingual nitrates and beta adrenergic blocker. Which of the following observation in ECG confirmed myocardial ischemia? So this is a typical case of myocardial ischemia, stable angina, effort-related chest discomfort or pain relieved by rest. This is typical of angina. The observation will be tall T peak, that is hyperkalemia. Depression of ST segment, prolonged PR interval, biphasic P wave. That is a depression of the ST segment. And inversion of T waves is typical of ischemia in certain leads, depending on the location of the ischemia. 5. A 55-year-old male patient admitted with severe crushing type of precordial chest pain and profuse sweating has electrocardiographic evidence of ST segment elevation in lead 2, 3 and AVF, confirming the diagnosis of inferior wall myocardial infarction. The sequence of cardiac excitation shown in the images A to E is depicted in the diagram. Which of the following phases corresponds to the ST segment? So we have an option, the phase between image B and image C. Is it the phase between C and D? Is it during the D? Or is it during the phase E? There is another option, none of the above. Now, if you want to choose the correct answer, you have to look at the various phases. This is the sequence of excitation which is shown in the image. A, B, C, D in correct sequence. A is the atrial depolarization. As you see, the shaded area, both the atria are completely depolarized. At A, there is P wave. You can also see the conducting system. At B, you can see the circle which is showing the AV node, the small circle. Atria are fully excited and the impulses have reached the AV node where is a delay. So this is the isoelectric segment. After the P, the isoelectric segment, there is no electrical activity shown in the ECG. There is a delay, AV delay. That is the PR segment, isoelectric PR segment. Interventricular depolarization from left to right as shown, which produces a small inverted Q in some leads. D is the ventricular depolarization. You can see the shaded area in both the ventricles. Both the ventricles are fully depolarized. And E is the last portion of the ventricle, the pulmonary conus and the top portion of the right ventricle and left ventricle getting depolarized, which produces an inverted S wave because of the direction of the depolarization wave. A starts from P and E ends in S. So PQRS are shown. Now, if you want to answer the question, ST segment is the segment between the end of the S and the beginning of the T. Any segment in ECG does not have a wave. An interval includes one or more waves, usually an isoelectric segment, but in this case it is not isoelectric, it is elevated. Anyway, the question asked is which phase corresponds to ST segment? There is no answer. It is not between B and C. It is not between C and D. It is not during the D. It is not during the E. So it should be none of the above. Well, let us see the explanation to this answer. ST segment is between the end of the S and the beginning of the T. ST segment occurs when the ventricles are completely depolarized, but yet to repolarize. ST segment is isoelectric. There is no electrical activity shown in the ECG. A flat segment, a straight segment. The phase between B and C, as I told, is PR segment. Between A to C is PR interval. Between C and E occurs the QRS duration because it includes Q wave, ventricular depolarization, and the last portion of the ventricular depolarization, CDE. C corresponds to the Q wave, D corresponds to the R wave, E corresponds to the S wave. So ST segment falls after E and before the onset of ventricular repolarization. The ventricular repolarization is not shown here.